Hello, my name's Richard Chillery, Chief Operating Officer. So why am I doing this vlog today? Well, Toby is currently on a mixture of annual leave and study leave, so I'm deputising for him. It's been a really busy week, starting this last weekend when I was on call. And it was an eventful one, and I just wanted to take this opportunity to really thank those services who work 24/7, who often work with people at their most vulnerable and distressed. It's really important and it's challenging work, so I just wanted to say a big thank you. So April's a really busy time for everyone as we finalise plans for the new year. So as the NHS runs its year from the 1st of April to the 31st of March the following year. And I know that feels a bit odd, and Toby's spoken of this before. So we're all very busy signing off budgets, agreeing service priorities and developments, as well as taking a bit of time to celebrate what has been achieved. I know your care group leaders are really engaged with all of this at the moment. As part of my deputising, I chaired the Clinical Leadership Executive meeting, which Toby has also again spoken of, which is a key forum for trust leaders within your care groups to come together to discuss things and to make really important decisions. So at CLE, I think a really important theme this month was how we support, protect, care for and celebrate our staff, patients, their families and carers. So over the next few months, we'll be working on an acceptable behaviour policy, which will be able to establish a structured and consistent set of standards and approach to managing unacceptable behaviour within the trust. And this is being led by Dr. Jude Graham, Director of Psychological Professions and Therapies, and our new Chief Nurse, Steve Forsyth. Alongside this, we discussed the National Safer Charter on Sexual Safety launched by NHS England in September 22. This is a zero tolerance approach to any unwanted, inappropriate sexual behaviours within the workplace, and we really want to ensure a safe culture in the trust. We've got a timetable for implementation on this, which we'll talk more to you about, and this is again being led by Jude Graham. In terms of looking after staff, I know Toby spoke last week of the staff meetings and hearing from our administrator colleagues. I don't know if you want to know about something we call a trolley dash. This is where the organisational development team visits colleagues across our dash and show appreciation, raise awareness of the support available through improvement and culture, diversity and inclusion and health and wellbeing initiatives, also offering goodies. So I think it'd be, you and your team really might like to have one of the trolley dashes come and see you. So if you'd like to visit them to come and visit you, the email address is now on the screen. So there's some really important messages there about creating a safe culture for our staff, also about looking after our staff, and I think more importantly we need to be celebrating. So I'm excited about a review of how we celebrate and recognise the amazing work of the staff. This will be coming out to you in your care groups from your care group leaders for your ideas as well. Please put forward your suggestions how we recognise you as colleagues for your hard work, innovation and dedication, and this celebration is really important. My view is go big or go home. We can't do enough to celebrate what you do every day. And then finally on this area, then on the 20th of July, we have the Trust Annual General Meeting, but we're going to include this as a fun day where there'll be loads of activities, challenges and events. So you're all welcome, and I'm sure Toby will talk more about this in future communications. And just to conclude, there were several other topics at CLA which I'll just touch on here. One was developing easy to read summaries of the multitude of policies for you in your busy work lives, and that's going to be rolled out over the next year. Also, we're starting to look at how we lean into the services around our change model. We want to really support and drive change at a service and community level. We'll continue to focus on the delivery of the 28 promises. And for example, one that's really important to me is Promise 19, where we need to end out-of-area placements for people cared for currently out of our communities to into our communities. This is going to be a really significant programme of work, and again we'll bring you more details. So to conclude, I just want to talk to you a bit about measles, which is on the increase nationally and locally. Do you know that measles is one of the most infectious diseases and can be passed on even before a rash appears? It is more than just a rash though, as it can lead to all sorts of serious life-threatening complications in people. So, what can you do to help? Be aware of the signs and symptoms of measles and display the posters in your work area. Protect yourself. Know your immunity status to measles. Read more about measles at the link on the screen. So that's been my first vlog for the Trust, which is perhaps a little bit daunting before I started. Hopefully all of that's been of interest. I think Toby will be back in the driving seat next week, but as he said last week, and I'm in full support, if any of you are keen on doing a vlog, we'll be delighted to hear from you. Thank you very much.